Now, there's different ways and methods to take a look at the overview and the data collection, especially regarding the document on cystic fibrosis. So basically, it's saying that there's two different perspectives that we have to look into. There's a patient perspective and there's a professional perspective, and it's talking about how technology might change the structure of this care, including this adopted grounded theory approach to the research. Now, grounded theory basically is a research methodology, and it uses inductive reasoning in contrast to hypothetical deductive model of the scientific method. Basically, they use this research method to analyze and pull the data in an iterative process, and it provides a structured process of analysis that has been widely used in the healthcare scene.
So one interesting thing that the article talked about was technology-enabled self-care and disease management at home, which is something that has caught the attention of researchers. And this is partly due to the interests of finding new ways to configure healthcare, outside of the traditional healthcare, the clinical setting. However, there are some challenges, like patients have to like share information with clinical teams, and there's this sort of thing of how it would like change the way patients interact within clinics. But this is also can be useful for the cystic fibrosis situation in Europe, in which patients struggle with like self-management, and this requires things like close collaboration between patients and clinicians. And I think that sort of the best solution here would be like a sort of like a self-management application that's specifically designed for people with cystic fibrosis. So this is something that actually a similar application my team and I created at the opioid hackathon. It's like a sort of like an app that was like geared towards people with like a certain like disease. It could be like, for example, like cystic fibrosis, an application that sort of like tracks like daily activities, and then the user could sort of bring his information into the clinic, which would be really helpful in my opinion.
Karen Pham, and from what we've learned so far, cystic fibrosis takes a huge toll on every patient's lives. Because of this, providers need to be super flexible on negotiations with their patients on their treatments. Not only do patients have to navigate their busy lives, but they also have to juggle jobs, family, multiple medications, and visits to the clinic. Most patients express that they do not want to acknowledge their lives with CF and tend to hide it. This is a very toxic mindset, and because it increases the chances of adherence to medications. Patients also tend to stay away from clinical visits due to either stigma of hospitals or to increased risks of infection at the hospitals. So technology does help a little bit. Some folks use calendar apps to remind them to take pills, even though it's hard to remember new and frequent ones. Others use tracking apps to help them track their daily steps, exercise, or nutrition. So remote monitoring tools like these help decrease the burden and allows patients to reflect on their health more often. So from the study, I really liked how patients were directly asked their opinions on their healthcare system. However, I don't think that it was very positive. It's really negative, and they did not offer many solutions. Some of the quotes were very repetitive and could have been left out, and there wasn't much analysis. I do believe that MDT should be really close to the patients and know them on a more personal level, so that patients would want to stick with their medical routine. The data and summaries are very important to reduce the dreaded hospital visits and to provide a holistic approach for care.
So the paper continues to explain how focusing on care practices on CF can help increase understanding on patient care, particularly to how these practices follow the chronic care cycles due to the nature of CF. It's interesting to see how technologies could evolve to cater to this issue, not just in self-management, but also in the collaborative activity systems Barger describes. So if new technologies were to develop, that means that activity systems in place would have to be updated too, which I believe brings the importance of tech understanding and integration. So let's say there's a new system created in order to help those with CF. No matter how well the system may work, if it doesn't become synced with the collaborative activity system in place, then it'll just cause confusion and ultimately result in failure. So the article relates to this when talking about considerations for reconfiguring this technology and the effect it might have on care provision. So I believe that it's important for developers to keep this in mind. It's another reflection of the type of power that they hold. Because no matter their intention, if the ultimate effect is skewed by undeveloped reconfigurations, then the CF healthcare is harmed. But as long as these factors are kept in consideration, there's still hope. Thank you.
Data shows that 90% of healthcare organizations are using remote care services to boost care coordination, and there's an increasing trend of patients embracing telehealth. Although telehealth is widely implemented and benefit at-risk patients, there are some limitations on the patient side. Research shows that 42% of providers that responded believe their patients prefer face-to-face interaction, which is a major factor limiting the telehealth adoption. Other elements include the lack of access to video-enabled devices such as smartphones or laptops, lack of confidence in the safety and security of telehealth, lack of technical knowledge about telehealth, and lack of reliable internet access. To eliminate these limitations, there's still a long way to go to improve the accessibility of telehealth.